here we go. All right, you are on. Do you mind a little introduction?
No, my name is Ann. I live in Las Vegas. I'm 51, and I had the surgery last Wednesday.
Right.
I was the last of your four, so you were all warmed up, ready to go.
I kind of figured out how to do it by now.
My surgery lasted 32 minutes, and he took 7 feet. I don't have diabetes, but I had developed high blood pressure about 1.5 years ago, and I'm now off my high blood pressure meds.
And you had a couple of days when it was slightly up.
I had, first I have to have a caveat here because I realized over the last weekend that I never really had a lot of pain in my life. So my experience was I had a lot of pain, and then as I'm sort of sitting there thinking about it, I'm thinking, well, when was the last time you really, subjected your body to pain? And probably 40 years ago, I broke my ankle, and I had surgery, and I still remember that pain from my broken ankle.
And how does this compare to this?
It doesn't compare at all in terms of intensity.
Right,
I mean,
okay.
but I'm
so
sitting
this
there,
is not as bad as a broken ankle.
Oh, definitely no.
Right.
But I'm sitting there going, oh my God, my side, and then I realized, well, Christ, you've been pretty lucky. So, so I'm not, you can't really use my pain meter.
Well, but let's delve into that a little bit. If you had to rate your pain between 1 and 10.
Okay. I would say the first night it was like probably a 7 to 8,
Yep.
and then it gradually went down, and it stayed at 5 maybe a little longer, and now it's 1.
Good.
Now today I woke up fine.
Good.
My other problem is I would get terrible migraines, and I got a terrible migraine. And I have to apologize. My handlers, my sister and my friend, were like freaking. And so I had called and talked with Trish and said, this, and she said, well, she'd talk to you about it. And so I'm just sort of laying there. My sister comes and she just starts freaking. And so I just need to apologize.
No,
she was a little rough on Trish. But you allowed me to take my Zomig, which is what I took for my migraine, and I ended up taking it. And I did take a 1 high blood pressure, my Topro, and my migraine went away the next day. So I'm not even really sure if some of my ancillary pain was from the migraine, and how the nausea that I would get from that, So it's kind of not a true judge of it, but
it's okay. Let me interrupt. Some people have pain after the surgery. When you hear so many people talking on the internet, they're all going, "Oh, it was wonderful. I had no pain. I had no pain." And we heard you kind of fibbing about it, saying you had no pain. And so people are a little uncomfortable, like you're kind of backpedaling, going, "Well, maybe I didn't really have." I mean, some people can have pain after the surgery, and we feel bad about that. We would like it to be pain-free for really everyone. But you have to realize when you're thinking about surgery, those of you thinking about going through this, you may have some pain. And looking back on it, it's not nearly as bad as most other people remembering other kinds of surgery. People who've had C-sections and, like you mentioned, a broken ankle, they say, I had some pain with this surgery, but it wasn't anything like the other kinds of operations I've had. But do remember, though, not everybody's completely pain-free. I mean, Steve went through it and just kind of flew through it. You had some pain, and that's the normal variation because we're people. Each of us, if you look around the room, we're all different. Each of us has a difference in so many ways, and similarly, the surgery has different kinds of results. It varies a certain amount. So some pain, although we feel bad about it, we apologize, we still think that this surgery probably would have given you much less pain than maybe a bigger type of surgery, the other kind of gastric bypass. And we strive for as little pain as we can, but some pain happens in some patients. And how's your blood pressure now?
I'm going to ask one of the nurses to take it here because it looks like it's like 140, without 140 over 75 or 80. Good. But I'm not sure that the cuff that I was using was really
it's probably not that accurate, but who cares? In other words,
it stayed always about the same.
Yeah, it was the 170 that won.
Yes.
Okay, and so 140s is actually still, just to remind everybody, slightly high. But we don't want to do anything about it now because we expect the surgery is going to continue to affect you. And so it's going to continue to bring you down so that in 3 to 6 months, you may actually have low blood pressure as a problem. In other words, so low that you'll pass out. So we don't want to take any extra Toprol or what was the other second medicine?
Hyzar.
Hyzar right now. We want to leave those things alone and kind of let the body adjust, and we expect that over time that blood pressure is going to come down, and your past history of being a patient with high blood pressure is going to be, you're going to be a former high blood pressure patient. And so we expect that will go away.
So,
It's
so
not,
I'm sorry.
it's not a bad thing to keep monitoring it, to watch it, but we expect that's going to come down.
Okay.
Now the other thing I was going to comment is your headaches.
Mm-hmm.
We often see headaches get better after the surgery. And the reason is that lots of headaches in heavy people is related to increased intracranial pressure. Okay? So what we find is lots of people preoperatively who see me, who have high blood pressure and diabetes and sleep apnea and things like that, also have headaches. And we find that postoperatively, in many cases, those headaches resolve. Even if they're called migraines or cluster headaches or tension headaches, whatever they are, we find they often get better. We often find they get better quickly, and we think the reason is because you pee out, you diurese so much water. So we expect during the coming days and weeks that your intracranial pressure will actually go down. And with that, that high pressure in your skull, as it goes down, you should have much less in the way of headaches in your future, if all goes as we hope.
And I'll tell you what, if that's the only benefit I would get from this, yeah,
Go
it
for
would
that.
worth. Oh yeah.
Yeah, because they're terrible.
They are. You know, that's a terrible. But other than that, I feel fine. I did have a stitch in my left side, and we talked about that. And it's a little. It's still there a little bit today, but other than that, it's a heck of a lot better than it was even yesterday. So.
And the way I comment on that, and this is kind of something I say all the time, and I hope you'll forgive me, but that stitch, that ache, that pain is because last week a masked man stuck up on her, stabbed her 5 times, crushed her stomach, stapled it, and cut through it and sewed on it. And so some aches and pains today, 5 days later, is not surprising. How long did your broken ankle hurt you?
For a long time.
Yeah.
6 to 8 weeks. Yeah.
6 to 8 weeks. So it's 7 days out that we're a pain level of 1 and having major surgery. I mean, we really do crush and staple and cut through the stomach. That leaves behind a little bit of blood. That is probably some blood up underneath her diaphragm that's still hurting, and that should get better. So we expect over the days and weeks that follows, that'll get better. And here's something else kind of tricky or paradoxical. If you have a broken ankle, they tell you don't walk on it because you'll hurt it. In fact, they put it in a cast and say don't put weight on it for a while. But then they cut the cast off and they say walk on it, and it hurts like crazy. But now it's time to walk on it, and the more you walk on it, the more the pain will actually go away. This kind of pain that you're having now will be made better the more you take a deep breath, the more you move around, and the more you walk on it. So you might be tempted to kind of nurse it a little, and we say, as uncomfortable as it is, get up and move around as much as you can. Even though those deep breaths can hurt a bit, this is a good time to do that because it'll help you get better more quickly.
Okay. But I will say that it is nothing, the pain was nothing. I wouldn't go through it all with 100 times the pain. Because I had to park at the very top of the parking lot, and I started developing some lower back pain over the last couple of months, and I thought, oh man, and my knees are fine, everything is.
So you had some knee pain.
I had some, yeah, I had tripped and had like pulled a thingy there, and every once in a while it would flare up. But the last 6 days, and it's unusual to go that far. So, you know, I just feel wonderful.
May we take your staples out?
Sure, it's not pretty.
That's all right. Just stand right there. Let's see where you were. It's good. And lift up your tummy there. Wow, I think that's beautiful.
Wow, it looks good.
Who did that? Oh, that's right, I did.
Yeah, some guy.
Some dude. That's great. I think they're really healing well. I think you're going to have a good cosmetic result.
Cool.
The wounds tend to heal a little bit better if you get those bandages off right away. So Steve left his on a bit, and it's just as well to get all that tape off right away.
I wanted to add that the hospital staff here is wonderful.
Oh,
and,
really?
The nurses that took care of me when I was here, the night staff, even the cleaning staff, they were wonderful. Mm-hmm. And your staff is, well, you're okay. I said you were okay.